It's been 6 months, 6 whole months without a uterus or a right ovary. And gotta say, no regrets so far. No regrets. The immediate acute symptoms of like the sharp pains, the bloating, the dull pain, the constant pain is resolved as of now, fingers crossed. We're hoping it stays that way. All of my incisions are healed. I didn't have any real issues there. I didn't have any infections or anything like that. I did have 2 sutures that like popped through, but they're the dissolving kind, so I just had to wait for them to go away. They were kind of bugging me, so I took some of those like little cuticle nipper dealios and kind of snipped them a little bit, but that's not for everybody, and it was barely for me. So doing really well. I think my only complaints, if you even want to call them that, I'm trying to still get my stomach tone back to where it was. Make no mistake, I was never toned, but I just wanted it to be like I lost a lot of my core strength. Like I found that I wasn't using my core as much because of while I was healing and whatnot, so I would like hold on to things when I didn't necessarily need to hold on to, like if I'm bending over, like hold on to the counter or whatever. Just simple stuff like that that I didn't really need to do, but that I found myself doing habitually, so I had to get out of that habit, and I'm trying to like get my core strength back. Just basic. And the other thing is like every once in a while, if I'm just sitting there, all of a sudden I have like a phantom pain of like the old pain from when everything was terrible. It only lasts for like a second or two, but for that whole second or two, I'm like, oh my God, no, it's back. Because, even with no uterus and only one ovary, of course, the endometriosis can come back. And so I have those moments of panic, maybe once a month or twice a month, something like that. So nothing too terrible. I'm still on the norepinephrine, whatever, acetate, 5 milligrams once a day because, like I said, I still have the one ovary, so still want to use that to control the symptoms and maybe inhibit the growth of any endometriosis that is still there, which is totally fine by me. But other than that, I'm not really doing anything different, not taking any other issues or anything like that. So one other positive that I have noticed is my acne. I know if you're looking at my face right now, you're like, still there, right? And I'm like, yeah, it is, but this would be like my skin is like perfectly clear for like 3 weeks, 21 days, if you will. And then for 7 days, it looks like this. And even this right now is 1,000 times better than my best day before. So I will take it. I'm all right with it. Nothing cystic, nothing painful, so I'm good there too. So fingers crossed that is probably not going to be the end, but fingers crossed that this is the last you'll see of me for a while, I hope. Yay. So take care.